it's wonderful to be back here in Farmley. Some of you in the room will remember that we kind of kicked all of this off on January 20th, 2011, when we had our first meeting of Europlan, which was the European initiative for countries to talk about what their specific priorities were in the rare disease space. And it was actually a very interesting day because, as it happened, the government collapsed the night before. I'm sure, I'm looking at Derek, you remember this. And we were, we'll push through. But we were lucky that one of the first decisions of the new government in relation to healthcare was to develop basically a working group to look to develop a national plan for rare diseases. And so what started as a slightly scary day led to the development and publication of our first national plan for rare diseases in 2014. And this room also held subsequent meetings to look at how we were progressing. And we did have some very good meetings along those years in relation to clinical trial development as well. So we've happy memories of starting something in this room. And, you know, as we move on to the next phases of the development of these conditions, I think maybe this is a good omen that we're here today. On the LEAP Day, the real Rare Disease Day, 29th of February. So my name is Avril. As Vicky said, I am the CEO of Retina International, a patient-led global umbrella group, and it's great to see our Irish member Fighting Blindness here in the audience today. I'm the voluntary president of Eurordis and on the board of RDD as a patient. I'm a person who lives with an ultra-rare form of rare eye disease. So I always say, please, if you see me, say hello, because I'm probably not going to see you, or so please, I always want to make that point, because sometimes the conditions that we live with as patients are not always visible, and I think that's always important to say. So we know that 36 million people across the EU today live with rare diseases, and in Ireland we also know that 300,000 people will live with a rare disease at some stage in their lives, and most of these conditions just do not have a cure. And this, of course, causes a lot of fear and frustration to finally finish your diagnostic odyssey and learn that there is no treatment, and that's a real reality for people and their families. We know at a national level that resources and expertise to treat these diseases are scarce, and that makes the added value of working at an EU level really critical, particularly for a small country like us. But, you know, we talk a lot about, a lot of the talk can be negative about our healthcare system, but once you get into it, I think a lot of us know that it is absolutely excellent in many ways, and to be able to group all of that expertise into ERNs here has been very, very important, and Eileen Tracy and the group at the National Office for Rare Diseases have been instrumental in ensuring that Ireland is now part of 19 of those European reference networks. That's really, really critical thing for us as a country, and shows that we're raising the bar, we're getting to where we need to be. But society is judged by how we treat those with high unmet needs, and people living with rare diseases live with high unmet medical needs in this country, sometimes ultra-rare diseases that have never been heard. This is the same in the north of Ireland, it's the same in the south of Ireland, and in our countries, nobody in this day and age should be left behind because they have a rare disease that little is known about. All our citizens have the right to diagnosis and care, to access to education, to employment, and that is underpinned by the United Nations resolution, which was unanimously passed in December of 2021, that recognises the rights of people living with rare diseases, and that includes access to a confirmatory diagnosis, to the care that they require, but also more holistically to that education, to that employment, and to avoid all of those extreme out-of-pocket expenses that we as patients really have to manage. And that's a real burden also on this community. So not only, I suppose, do rare diseases affect our health, and that's why we're here today to talk about things from a health perspective, but they do affect every single policy, part of our life. And so the policies that we are developing as we approach new strands of strategies and plans must absolutely encompass that, and how we manage our diseases, how we fight them, and how we fight for our future is really important, and it's great to be able to speak to future policies today. So I would mention the Rare Barometer study from Eurordis. Many of you will have seen that, where it talks about the burden and the disproportionate burden that affects women in this environment, with 64% of women having to make sacrifices to maybe education and employment themselves to take care of children, of siblings, of parents, of spouses. But, it's changing a lot, and I think it's very important that what I'm seeing, certainly from a European level, is much more of the family getting involved and the burden being on them. So that's important to remember. So look, I wanted to mention that because I think it's important to understand that there is a European framework for rare diseases being advocated right now. Out of 27 member states, 22 of them have signed up to develop new plans and strategies, including, thankfully, our own government here in Ireland. And that is something that, as a European organisation that I represent, we're working very hard on. They're over in Strasbourg actually today, talking to our MEPs about all of this work and pushing it forward, because we need a framework. There is a lot of legislative review happening right now in Europe to look at things like health technology assessment, the pharmaceutical legislation, the European health data space, transparency directives, that sharing of data, which is critical for us in rare diseases. We must understand this is all being discussed at the same time. We're entering into a European election in June. We need to keep the momentum moving forward, so when we have new leadership, this remains a public health priority. But the signs are good, the indications are good, the support that we're having at a national level we should be very thankful of. And I'm really looking forward to hearing from Ryan Wilson shortly in relation to what's happening in Northern Ireland. But before we do, and before we get on to our panel, I'd like to introduce Cecily Kelleher, who is going to speak to us about her role as chair of the plan for the next rare disease, the rare disease plan and strategy in Ireland. So I'll hand over to you, Cecily, to update us on what's happening, and we can discuss that further on our panel. So thank you very much.
Thank you very much indeed, Avril, and good morning, everyone. I'm Cecily Kelleher, and it's been my privilege to be appointed to chair the National Rare Disease Steering Group by the Chief Medical Officer, Breda Smith, and the Minister for Health, Simon Donnelly. And my background is in public health medicine, cardiovascular epidemiology. I've worked for many years in non-communicable disease, in disease surveillance, and also in health promotion. And so I haven't been directly engaged with the National Rare Disease work previously, but I was tremendously privileged and intrigued to be asked to facilitate as a chair this tremendously important work. And so I'm delighted to be here this morning. I thank Vicky McGrath of Rare Diseases Ireland for this invitation. And she set out for you the challenges that face us in this space. And also, Avril, it's been my privilege to meet you and to be associated with the work you're doing, and you've just outlined for us what needs to be done at a European level. So today we're talking about driving change through rare disease policy. And what I hope to do is give you some background to this. If I can change the slides. And just to set out We started this work in December, and from the get-go, there's been huge and positive engagement with this work. We had our first meeting on the 7th of December, and our task is to develop a national rare disease strategy with an associated action plan. There are 15 members at this point on the group, and it is very much a focused interdisciplinary group with patient representatives, with advocacy groups, clinicians and clinician scientists, membership from the Department of Health, from the HSE, and from the Health Research Board. And just to briefly introduce our group membership, Eileen Tracy as the clinical lead for the National Rare Disease Office, Abby Collins from Public Health Medicine for children in the HSE, Atifa Wan, who's a clinical representative for the Paediatric ERN, Cormac McCarthy, who's a clinical rep for the Adult European Reference Network similarly, Mark Bale, who's the national lead for genetics and genomics, Una Ward from the Health Research Board, Derek Mitchell, co-chair of IPOSI and our Patient Forum, Vicky McGrath, also a co-chair of our Patient Forum from RDI, Ciara Martin from HSE Integrated Care, Dervla Gray from HSE Integrated Care, Kieran Murphy, Rare Disease Policy from the Department of Health, Rosie Gowan for Clinical Lead for the National Clinical Programme for People with Disability, a nominee from the ICGP, and also delighted that Alan Finglas and Gillian Stafford were able to join us as patient representatives. So you'll see this is a strong group at a very key time. And one of the key pieces for me is not just that these developments are happening at a European level, but we are at a point of major development here in the Republic of Ireland in terms of the rollout of Sláinte Care. And a key to this will be local, regional, and national action. A thing that attracted me most to this is that patient involvement is key to this. We have 2 patient representatives and advocacy group representatives on that group, but we also have an underpinning rare disease forum, which met for the first time on the 14th of February, co-chaired by Derek and Vicky. And to me, that lived experience is going to be crucial to the policy that we develop. We have to ensure that the rare lived experience of living with the disease and families remains a focal point for the new strategy. One of the key occasions in recent weeks was the IM17, and this very much reflects what we must do here. We must move that odyssey into a journey that is manageable, real, effective, and I see this as a key underpin of the strategy. The steering group terms of references are available online, but clearly we need to consider how best to improve that access, to ensure appropriate access for people living with a rare disease and integrated care. And that will be a key part of this forum today. We will have consideration for those European developments, particularly the ERNs, but we need that robust consultation process, and that has been underpinning since we started this work and will right through to the recommendations of our policy. Feedback around the quality of registry frameworks is a very important component of this, as is promoting rare disease awareness and participation in national and international research. I'm also very cognizant, as you will be, that if we arrive at a strategy, we must have a means of implementing it. It must fit into the governance that is developing in our healthcare system here in the Republic, into the international framework, and there must be a clear funding implementation plan to roll out of that work. So very much it is on a timeline, but to deliver. The themes for consideration and the way we are working in relation to this will be very familiar to people in this room. Patient engagement and empowerment at all parts of this, not just in the consultation, but in what we actually roll out, will be crucial. The work in relation to genetics and genomics will inform very much what we are hoping to achieve as well. And of course, therapeutic care will be a key part of this, as will research and clinical trials. We must learn from our European experience, engage with it and deliver upon it. We are already getting very significant feedback in relation to the protocols for newborn screening, for data registries and for care pathways. So the plan will be comprehensive. The work to date has moved along apace, even in the last few months, and we have a very tight work programme that will roll through to the middle of this year. I've already shared with you briefly the terms of reference and the work plan to be developed. We very much are working to moving on from the last National Rare Disease Plan in 2014 and to the future. And to Vicky's point, we believe it will be at least a 5-year plan. But this is a very rapid-moving, scientific, social, and community, political sphere in which we're operating. So we have to really capture all of that and align with the EU's rare disease framework. One of the first documents that was commissioned and produced and is already available was published on the 8th of February, was a piece of work undertaken by HICWA, which was to review rare disease developments in selected countries. And that work was ably done, presented to us in the working group and published, as I say. 12 selected countries were reviewed in that, including England, Northern Ireland, Scotland, Wales, and selected European countries, as well as Australia. And that looked at a systematic online search for national strategy documents and, as relevant, key interviews from each country to confirm relevant resources. Those strategy documents identified for all 12 selected countries looked at the main strategies and action plans. They looked at the evaluation of recommendation documents in 7 of those countries and also supporting documents. So it was a very thorough initial piece of work. Our next steps as we go forward in relation to this is to work with the Patient Forum, which will continue to meet and which I hope you will engage with to inform very much the work of the steering group. We also plan a wider consultation, a public consultation, to ensure that all stakeholders can input into this new strategy. I have had so many people contact me since I started this work in December, and I'm very hopeful that we will get the level of engagement in that consultation that will truly inform the work of this policy. We've already had quite an approach to a focused steering group process, and we'll be meeting very regularly, more frequently than monthly at the moment, with aims to produce the new strategy. And I am very clear that we will develop an implementation plan, an oversight group that will ensure this new strategy is fully implemented. So it's a pleasure to be here this morning, a pleasure to participate in the meeting. And I thank you for listening to my brief summary, and I suggest that it's time now to leap ahead. Thank you very much.
Thank you very much, Cecily, for that overview, and we look forward to discussing and getting into this at our panel. I'd now like to welcome Ryan Wilson to the stage. Thank you, Ryan. Good to meet you. Ryan is Director of Secondary Care, Northern Ireland Department of Health, and he's the Chair of the Northern Ireland Rare Disease Implementation Group. And so I think you're going to speak to us today about what's happening in Northern Ireland, and I think it's really important for us to have that perspective of what's going on the island, and we can learn more about your work. So thank you for joining us this morning.
Thank you very much, Avril. Can you hear me okay, folks? Good morning, everyone. As Avril has introduced me, I'm Ryan Wilson. That's me from the Department of Health in Northern Ireland. I'm the Director of Secondary Care, which is a policy team looking after many hospital services, but one of my roles in the department is as Deputy Chair of our Northern Ireland Rare Diseases Implementation Group. So I'm going to talk a little bit about our policy work and how that is hopefully relatable to actual change and service delivery on the ground. But I also want to say all of the hard work, and that is not done by me, it's done by my colleagues, Finola, Anthony and Scott, who are here with me today. So I hope we get a chance to speak and meet with you during the day. So thanks also to Vicky and colleagues for the invitation to attend this event today and the very warm welcome. I've been at some of these events over the years in Belfast and Dublin in a couple of really brilliant venues and really good events. And I suppose congratulations for keeping that momentum going even during the COVID years in some shape or form, and to keep the communication going between our two systems. But it's really good to be back in person and to have the opportunity to speak with you all today. So, firstly, just to speak a little bit about the strategic background. You just heard from our new old health minister, as Vicky referred to him, Robin Swan, who has just come back into post in the last 3 or 4 weeks as our health minister. For us as officials, that's really beneficial because Robin was there. He was the minister who launched our current action plan back in 2022 and had signed up to our strategic commitments under the UK Rare Disease Framework. So it's really helpful to us as officials to have a minister who knows the crack and the background to this and has previously sort of stated his commitment to progressing our work on rare diseases. As he said in his video, he has been a great supporter of this work in the past. Many of you know that the Rare Disease Framework that I referred to, the UK Rare Disease Framework, was jointly published by the 4 UK health ministers in January 2021. Obviously, we were in mid-COVID response at the time, but we tried as best we could to keep some of our normal policy work with some momentum during those times. The framework outlines the UK's priorities for rare diseases over a 5-year period, and sets out a framework for each of the nations then to develop its own individual action plan, which is specific to the priorities within each region and the needs of the population. And we work together through the Rare Disease Framework Board to ensure that those respective actions are aligned under the terms of the framework. So the next slide here, you can see the photograph which was marking the launch of our action plan by the Minister in 2022, here with the then Chair of the Northern Ireland Rare Diseases Partnership and our Chief Scientific Advisor Ian Young, who chairs our implementation group. Unfortunately, Ian is unable to be with us today because he's in New York and sends his apologies. So the implementation group, or NERDIG as we refer to it in short, brings together all of our stakeholders from across the policy areas within our department, our 5 health and social care trusts, our commissioning public health partners, research and development leads, academia from the 2 main universities in Northern Ireland and the Rare Disease Partnership. It's similar, I think, to the steering group that was recently been established here, as referred to by Cecily. And during 2021, our implementation group worked with all the stakeholders to develop our action plan for Northern Ireland and consult with the rare disease community to inform the work that the partnership had done previously. And identify the priorities that we could realistically try to take forward over the next few years. So I just want to give you an overview of the working groups that exist under our overall implementation group, or NERDIG. We've agreed to 14 high-level actions with an overall vision to improve the lives of people who live with a rare condition in Northern Ireland and their families. We have established or grouped those 14 actions into 4 working groups who are responsible for taking those actions forward. And the working groups are led by members of the implementation group and have representation from our Northern Ireland Rare Diseases Partnership, as well as clinicians, academics, commissioners and research and policy leads from across our health and social care system. Those groups have been working really hard over the last couple of years, despite many financial and resource challenges and many busy day jobs on top of that to take forward the action. So there's really fueled on a lot of goodwill to try and take forward collectively. I mean, I've seen as Deputy Chair of the group a real will to do what we can within very limited and challenging circumstances to try and keep some momentum. And I'm going to just speak a little bit about what has been progressed over the last couple of years. We meet as a group every 3 months to just hear updates from each of the working groups and try to keep that momentum going. We published during 2023 a Year 1 progress report, and that's available on our departmental website. And at the minute we're just working on our Year 2 progress report, which will build on that. As I said, despite a very challenging financial climate, and we, as you know, have been operating without an assembly, without fixed budgets for several years. We still don't know our budget for the next financial year. So that's the kind of context within which all of our policy development is taken forward. But despite that, our work on the action plan to date has managed to make very good progress. And there's a lot that I think we can be proud of. And referring back to your newly established steering group, I think it would be there's opportunity there for us to maybe build more communication and maybe learn from each other as we do that, because I'm sure that the same challenges will exist for yourselves. That is down to the hard work and the commitment and the focused determination of the NERDIG members, and by extension the other stakeholders who they represent and their respective organisations. Many hours of time on top of their busy workloads to keep those actions driving forward. I hope some of those members have made it down on time. I know Patrick, I did see Alison and Laura, but hopefully other folks from the Rare Diseases Partnership are here today as well. So today is an opportunity for me to place on record again our thanks to all the members and the working group leads for what they've achieved so far in rare diseases. And we're very grateful for their continued support and their efforts. So, just to mention what's on the slide, those are our 5 sort of key working groups. Group 1 looking at the development of a rare diseases expert centre, the establishment of a patient portal and information hub. Group 2 is looking at the development of registries, pathways, specialist drugs and treatments. Group 3 is looking at education and training. Group 4 is tasked with research on rare diseases, and in Group 5 we're scoping the possibilities or the different options for having a rare diseases champion for Northern Ireland, and a lot of that is developmental scoping work. Some of those actions will require funding or recurrent investment to take forward, but we've been able to take forward a lot of the scoping and exploratory groundwork to hopefully build on that when we do have a bit more budgetary certainty, hopefully in the future. So progress to date, we're now approaching the end of our second year of the 5-year action plan. And this is just to give a brief overview of some of the progress since that was published in 2022. In year 1, our focus, as I said, was groundwork for future years, scoping, developing what the costings or the investment requirements may be for a rare disease registry, reviewing our rare disease coding infrastructure to inform the registry. We've drafted an options paper looking at the potential for the rare disease champion, as mentioned, and a task and finish group which is developing guiding principles for our healthcare professionals when transitioning a child with a rare condition into adult services. There's extensive work ongoing, as I said, within the research group and applying for funding across various external sources, and there's been some success on that front, which has helped to move the agenda forward as well. We've also tried to move the agenda forward by linking with other strategies that have been published by our department and by the UK government, which we're a part of. That includes Genome UK, our Northern Ireland Mental Health Strategy, and our Encompass programme, which you may have heard of. That is our major flagship digital infrastructure programme, which is currently in the process of introducing a digital electronic healthcare record in Northern Ireland, and we've spoken about this with rare disease community over years. It's now actually come into fruition, and we've always thought that rare disease community is one of the groups that's most likely to see benefit from that development. So it's in the early stages of actual rollout across our trusts. There will be more development to come, but I think that's an exciting development, particularly for the rare disease patients and their families. During the period in recent years when the Assembly was suspended, there was an all-party group for rare diseases established, and that's continued to meet despite the Assembly being in a pause for a couple of years. So we've had the chance to engage with our all-party group as well, and that contains members from across the main political parties, stakeholder groups, who have come together to look at overall rare diseases and a couple of deep dives into specific issues. So we hope to have a constructive relationship with that group as well. It's really helped to bring rare diseases to the forefront in terms of the political stage. And another really significant development for us in Northern Ireland has been the appointment of both an adult and a paediatric rare disease consultant in our health and social care system. Those are, I'm going to name them, Alison Muir and Patricia O'Hare, respectively, and they provide clinical leadership within the Belfast Trust and across the region, with the aim of driving forward the coordination of care for conditions such as inherited metabolic disorders and inherited cardiac conditions. So moving on to year 2 progress. As we got into year 2, as I said, there had been good progress made to sort of set the foundation. We managed to secure a small amount of non-recurrent funding to help implement the action plan, and we've been determined to try and make that count. That funding has been used to provide much needed resource support to the working group leads, the 5 groups that I mentioned under our implementation group. And it has funded additional genome sequencing of rare disease patients within our regional molecular diagnostic service in the Belfast Trust. And that helps to provide a diagnosis faster than otherwise would have been possible. The funding's also contributed to a patient and carer survey, which is going live, I believe, this week, and to gather the experiences from rare disease research participants in Northern Ireland. And that will identify challenges that currently exist and how we may overcome them. Some of that funding also has gone to our friends in the Northern Ireland Rare Disease Partnership, and that will help to support further engagement across the rare disease community and gather some feedback on the action plan to date. So it's really important that we have an opportunity to do that engagement across the region. Some funding was also put towards the development of an online database of education and rare disease resources for students in the Ulster University to complement the newly formed Rare Disease Society in the university, and it will help raise awareness of rare diseases right across UU, help to unite the students, encourage advocacy, and foster a deeper understanding of rare conditions which are prevalent in Northern Ireland and beyond. In year 2 of our action plan, there's also been, as I mentioned, a number of research bids that have been successful and are coming to fruition. That has been funding for the development of an online support tool for carers of people who live with a rare disease, called Caring with Rare, and the Rare Disease NI webpage, which is currently in phase 1 of the Northern Ireland Information Hub. So both of those are in progress, under construction, and not yet live, but hopefully will be soon. We've also seen the creation of specialist service manager posts to support the rare disease clinical leads that I mentioned in adult and children's services, and that will help to support care pathways and ensure better clinical support for the rare disease agenda. So I want to also, while I'm here, congratulate Laura Cassidy, who is with us, and Patricia McGuinness on their recent appointments to those important roles. So there's a lot happening across year 1 and 2. That's a flavour of some of the work that's been done, as I said, on limited investment, but I think it exemplifies just what can be done if you gather people together in a room or virtually and ask them to work together. I'll finish just by speaking about our plans going into 24-25. As I said, we have the return of some form of political normality in our assembly. We hope that will open up some opportunities for us with the profile that the all-party group has brought. There are wider developments taking place in genomics, in the Encompass programme, and in research through clinical trials, and the ongoing work of our rare disease clinical leads. All of this will contribute to the further progress with our 5-year action plan. And we hope to explore further cross-border opportunities, whether that is in the areas of specialist care, genomics, or clinical trials, whatever ways we can to help improve the lives of people who live with a rare condition across the island. And the All-Ireland Rare Diseases Interdisciplinary Research Network, or RAIN, I think is a prime example of the power of cross-border working. We'll also continue to work very closely with our UK counterparts, as we do through the Rare Disease Framework Board, and learning from each other, sharing expertise and experiences, and combining our efforts where it's possible to help influence strategy and policy. I think if we've learned anything over the last 2 years and the years that preceded that, it is that working together makes us stronger and can lead to progress in difficult circumstances. More funding would be nice, and as I said, will be necessary for some of the big objectives within our action plan, and we know that. And hopefully in year 3 we will be able to secure further funds towards the Rare Diseases Registry and the Information Hub. But our implementation group and its component members and organisations, I think, can be extremely proud of the progress that we've been able to make, particularly over the last 2 years, in sowing the seeds for the future work. Again, like your steering group previously mentioned, it would be remiss of me to finish without stating the vital importance of the lived experience role in all of this work, and our action plan would really be meaningless if we didn't have input and regular engagement from the rare disease community. So I want to thank the Rare Disease Partnership once again for working with us closely and facilitating that patient voice in policy development and implementation. I'll finish by saying that myself and colleagues in the department and our minister are committed to further progress with our action plan. We'll continue to play our part to raise awareness of rare diseases on the political stage, and in terms of our strategies and policies, and to push for resources as much as we can to continue to deliver on our action plans and our strategic commitments. I think it's important we collectively do whatever it takes to put anyone who's living with a rare condition and their families at the heart of health and social care across Ireland. So I will finish there, and thank you all very much.
Thank you. Thank you, Ryan. Thank you so much for that very comprehensive presentation, as I certainly have a lot of questions and I know we have limited time, so I might just ask our panellists, Cecily, Ryan, Derek Mitchell, and Gillian Stafford, to join me here for the panel discussion. Thank you very much. Take your seats. So I might just start with you, Cecily. You're right next to me. So, it was really great to hear that the plan is ongoing, and I think the engagement from other stakeholders is really critical, and the structure of that happening parallel is very encouraging, I think, to a lot of us who are patient representatives in the room. But I suppose the question that always is asked really boils down to timelines and implementation at the end of the day. So I just have a quick question, like the timeline for this, and then looking at that implementation piece, what are we looking at from that perspective?
So we are on an ambitious, but I believe achievable timeline. So this work got up and running, and at the end of December, by mid-year, I would hope we would have completed most of the consultation components, and the plan should be well and trained to be drafted and completed. So I would say our ambition is to have a plan rolled out comfortably in 2024.
Great, that's encouraging, and I think, Ryan, one of the points that you raised was engagement cross-border. There are a number of areas, I suppose, that we would be familiar with here in the South with respect to the work that you're going on, particularly genes and genomics. The possibility of working more collaboratively. I mean, from the fact that we're in this development phase, is that something that you think would be priority for us and something that we should focus on?
Yeah, I think it's possible, and it's been a long-standing commitment from our minister and previous ministers within the UK framework and the previous UK strategy. There's always been a recognition that in Northern Ireland we have obviously an opportunity to collaborate more closely with neighbours in the south, and that makes a lot of sense. I think, I've been involved previously in establishing the Congenital Heart Disease Network, which is a different type of service, but I think it has proved the potential of working together where it's feasible and where there's benefit. I think on a practical level, in terms of establishing the steering group, policy officials, and at that level, there's definitely potential in learning, and we're very happy to work together. Also on the clinical level, and in terms of the engagement with the public, there is potential there. It's we have challenges in that, and protecting enough time within our department and resources to do it, but certainly there's political commitment to that and cover, which I think we can build on wherever it's feasible and where there's an appetite to do it.
Yeah, that's something I think we've discussed before, and I think last year in Belfast, it was when we were in Stormont, that was one of the key areas that we were discussing. And Derek, I'm looking at you. Derek is the CEO of the Irish Platform for Patients' Organisation, Science and Industry. Not your first rodeo when it comes to rare disease national plans. I know that you were involved in the development of the plan that was produced in 2014, and are, of course, engaging in the committee here in Dublin under Cecily's chairmanship, which is fantastic, by the way, and we must compliment you on the work that you're doing. So, looking at it from being through it before, is there something that you would say the pitfalls that we need to avoid? And potentially what we can achieve this time round? Exciting to hear about the various forums and consultations that are happening here, which, so maybe you could just elaborate a little bit on those.
Thanks, Avril. And I guess for those of us in the room or online who are that long in the tooth, I guess for me, I would probably ask the question, well, the question that invariably comes to me about national development of national policy is, so what? For both patient groups, individual advocates, but also the what you might call the health interested public, which IPOSI now has, I guess, the reach to through our citizens' juries. And the other kind of question that says, in terms of what's different this time, and I think for me, what's different this time is there's two key elements that weren't in place when the last plan was developed. And as you're well aware, the last plan was developed as a result of what you might call pressure coming down from Europe. Whereas this time, the pressure is coming from within. And that's very different if you think about the willingness to engage with the very complex cases that often come through from the rare diseases, the diversity of voices that often are there, and how you bring that into a coherent plan that can implement. So if the motivation is coming from within, and when I say within, I mean from within the Department of Health, there is a very strong, dedicated team in the CMO office that's helping facilitate the development of the plan, but has that expertise in both policy and implementation. So that was not there before. We have a number of members of HSC, the key HSC departments and roles, and as Cecily mentioned earlier, the way in which the HSC is restructuring around Sláinte care, rare diseases has a massive opportunity to be firmly embedded within that new structure. And for me, that's very different from before. Because I think it's fair to say that the previous plan, despite a huge amount of work that went into capturing a very comprehensive plan, it didn't implement as well as it could. So that's what I'm looking forward to ensuring that's different this time around. And another key opportunity is around the way that we structure and collate the lived experience. And again, despite the best efforts of many of the patient groups and advocates of the previous plan, that was not there. Yes. So, and I'm very much looking forward to how we're going to structure the Rare Disease Forum. We've just announced a couple of working groups that we're going to concentrate on the kind of things that maybe Ryan was talking about in terms of those maybe, kind of short-term actions that will produce real benefits and real impact for those living with rare conditions. That's in the coordination of care, the integration, the transitions, and accessing services locally and regionally. Those are the kinds of things that they're really, I don't know if Anne Lawler is here, but the back of the ranch kind of things, right? Yeah. So we're getting moving on those. But as we're moving, we're actually learning how to structure this, because we've had over 100 expressions of interest to that forum. Those of us who are chairing it and the patient reps on the National Steering Committee we take it as a kind of a responsibility to ensure that forum is as impactful as possible, not just in the development of the plan, but the implementation of the plan. And the last opportunity, I think, which is different this time around, is that when you speak about implementation and where it fails or not, you need champions within the public health service and system, the likes of Robin and Ryan, who are always pushing for viewing the legislative, the regulatory issues through a rare disease lens, and bringing that lens constantly to the table in those kind of broader issues and linking with them. And what's different this time around is that from the very strong messages we've had from the CMO's office, and when the next CMO comes into place, we'll certainly be looking for them to come and to really appreciate how rare diseases can be part of their agenda and can have wins for them as they operate in that broader scheme. So again, big opportunity for rare diseases. And that's what maybe I would be responding to Cecily's point about leaping forward. So
yes.
That's where the leap can come from.
The leap, yeah, exactly. And that's that's important in understanding that patient engagement piece that you mention, and the fact that you're providing that platform to really discuss real world issues that are really fundamental. And Gillian, as a patient representative on that committee, bringing that lived experience to the table. I mean, one of the recommendations that we've had at a European level when we talk about action plans across the member states is that integration of that lived experience with health. So the integrated health piece, how do you feel as a patient that can be brought forward? Having on the panel, of course, with Alan is critically important, but from your lived experience, is that opportunity there for you to really discuss the day-to-day and the reality?
It's not there day-to-day. It's great that I'm on the steering committee, but what I find is that because our patients with rare diseases, a lot of the consultants and medical people in Ireland don't know about our disease. So a lot of the times we're in and we're fighting for ourselves as patients, so it can get tiring. So I think there needs to be more education around how people in the medical fields or even in the HSC or different areas can work with patients. Because a lot of the times you're going in and you have to describe your illness, and sometimes you get fed up by going in and there's somebody with a medical professional sitting in front of you and they're saying, well, we don't know what this is about, and it feels like I'm fighting all the time. Where being part of the steering group with the patient forum, I feel like my lived experience has been listened to, where in other areas it hasn't been up to the stage.
So you're being listened to.
I'm being listened to, and actually,
yes.
if I have a point, I'm not afraid to actually say within the steering group or the patient forum, because I know I'm in a safe environment where I could express my opinion and it's being listened to. Where if you're doing it on your own, it's kind of people, you're knocking on doors, but they're saying no to, and you get fed up with doing that on your own. So I think it's a great experience being on the steering group.
And I think that was evident, and I had the pleasure of attending one of those meetings to present, and I can say to those in the room there was a real energy, and everybody had the opportunity to speak. And I think one of the really interesting presentations that I saw on the day, Cecily, was the HICWA report, where HICWA have looked at 12 examples of rare disease implementation across Europe, and I think a little bit beyond. How has that helped you in sort of framing that discussion?
So absolutely. So we have to learn from the experience we've had already. We have to build on important developments like, I would instance, the National Rare Disease Office. I would also think that it is crucial now that we have this rollout of Sláinte Care with all the challenges it has, because that's a real window of opportunity for high-class surveillance, for the establishment of the registry framework, all of those things. But I think Gillian's point about engagement is crucial to all of this. And we have to capture that journey, and we have to translate that journey into a healthcare delivery system that will pick up on that experience, that will know where the pathways are for referral, for care. It is crucial when you step into your GP's surgery at a local level. It will be crucial if you go to your county hospital or some other regional service. It'll be important that we have a national framework that understands protocols of management. So at every level, this is going to be very important. And to the point about the HICWA piece, so we have to learn from what's going on in our own jurisdiction. I think the cross-border dimension, it was really interesting to hear so much that you've already got done, and we really should share that partnership. Wearing another hat as a Dean of the Faculty of Public Health Medicine, we have a lot of cooperation cross-border in that area, so that's another piece to build on. All of our healthcare systems are different in the way they're organised around the European region. We learned a huge amount during the pandemic period in relation to shared data and surveillance, how different healthcare systems are delivered. So that's the whole purpose of the HICWA exercise, to tell us in those 12 different jurisdictions, how did they translate? And this is all about translation and implementation. And so I gave you a timeline shortly ago. We will try to keep to that. But more importantly, we must ensure that there is an actual who, what, how component to the implementation.
Absolutely. I think, Derek, you had something to...
Yeah,
put on
I
there.
think what struck me about the HICWA review, two things that struck me. One was around a lot of the priorities in other countries are the priorities that have been identified in already. And there was huge consensus that these remain priorities, these remain unmet needs for many patients. The other thing was about the influence of the UN resolution and how that is starting to filter through into the national plans, and how if you take that more universal approach to healthcare, that these areas are now coming into the prioritization process. And it's great to see that coherence between global level, national level, and feeding down hopefully into that regional and local level. The other thing that struck me around what's happening now, and really struck by the examples coming from Northern Ireland in terms of the Encompass initiative and
Yes.
electronic health, and we're finally seeing the building blocks of what would be ultimately the rollout of digital health in Ireland. And I think by the end of next month, you're probably going to see that national framework for digital health, together with an implementation plan, and yes, a price tag associated with what the necessary investment that's going to be needed. But I think if you look at that kind of whole piece about, well, how then do you bring a rare disease lens to that? Yes, we need the ORFA codes. Yes, we need in the clinical systems. Yes, we need the data moving between different silos and sectors. But fundamentally, we need to use that data for secondary purposes, for research, for innovation, and patients and citizens need to be part of that. It's because fundamentally the data is ours and it is theirs. So that is a wonderful opportunity again for rare diseases to bring that lens, because if we think about how we can leap forward in terms of trusted research environments, we can build these things. These are not rocket science. It's been done in Northern Ireland, it's been done in other jurisdictions. There is absolutely no reason why we can't build these. But the real leap forward would be to build it with citizens and patients right at the very heart in terms of the use of the data, for different purposes, whether it's surveillance or whether it's public health purposes, or indeed for those research priorities that people have actually said, this is where our data should be going. So again, really good opportunity.
Thank you, Derek. And I know Vicky will have words with me if I don't open this to the floor. So I think does anybody have any questions? We just have time for maybe one or two questions. I think there's one here. Yes.
I have more a comment maybe rather than a question, and it refers specifically to what Gillian said. I'm Mary Carney. I've experience in general practice. I've experience as a European Reference Network, as a patient advocate, and I'm a parent with two children who've got a rare disease. And no general practitioner and no doctor can know absolutely everything about the 5,000 plus rare diseases. So I've been advocating that the patient journeys, which we're doing at the European Reference Network, and the care guidelines that people have for their disease, that the patient should have them and present them. And I know it's an added burden for those with rare diseases, but I can only see that as the way forward, as no person could be expected to know every in-depth detail about every single rare disease.
Mm-hmm. Does anybody want to take that? It's something I think that we've all had challenges with throughout the years. It again goes back to the limited experience. But I think Mary, you've been fairly instrumental in engaging GPs in understanding rare diseases and having some patients speak to them and using that sort of forums for discussion.
Yeah, but I've tried to do that, but it hasn't been very successful. It's very hard to engage general practitioners in rare diseases because they're saying rare diseases, let the hospital look after that. Yeah. That's not, when you have a rare disease that you live your lifetime with, the general practitioner does need to know about it. And I hope in my work that I'm at least receptive, Gillian, if you come to me to say, yes, what do you know, and to listen to what you know. And it's that the general practitioners would at least listen to the patients and acknowledge and know that the patient organisations know so much. So I am trying to do some work around that, but it's really, not easy.
Yeah. I'd just like to say, I think I really welcome that, and I think I've worked in a number of studies that have engaged general practice as part of wider work, looking at patient health records, for instance. I believe it's going to become a much easier proposition to be able to bring data or information with you and to put that over in the consultation that you're having one-to-one. We have placed a strong priority about general practice engagement in the steering group, which we are rolling out. And I think, yes, absolutely. But in a number of the studies I've been involved in over long years, the key component has been to get the GP engaged with the broader delivery system. So it's a very good point to take on board.
Yeah, I completely agree. And I do think that access to your own health record will be part of that conversation, but it's no general surprise to me to see that we still remain with a gap on the National Steering Group from the ICGP, which reflects the challenge of identifying someone who can actually then channel it back.
It's a broader issue than that. It's the person with the rare disease going to casualty, and the casualty doctor doesn't know anything about it. That's where the patient really needs their guidelines, and I see somebody nodding their head here in front of me as well. It's not just a person's GP, it's the whole...
Absolutely.
And nobody can know everything. So that's why the patient needs to take a little bit of ownership and bring their guidelines with them.
Yeah.
And just to build on that, my name's Karen Walker from the Multiple System Atrophy Trust, and we support people across the UK and Ireland. And quite rightly, the GPs, how could they know about MSA? They get one in their full career, to their surgery, perhaps. But one of the things I've been interested to listen, and I'm very interested, Gillian, in what you had to say, because, obviously the patient voice is one of the things that we're very involved in. But as a result of that, we also have developed information that we can share with GPs and with hospitals. And we've also developed packs such as, I wish I'd known that a year ago. And we've done that for the South, for Ireland, as well as for UK and Scotland. Wales is just completing, Northern Ireland is on its way. So, we do have those things that we can send to people, but it's how we can feed in as well to the development of your plans. That's what I would be very interested to hear more about today.
Great. Good points to take on board, for sure. And we might have time for just one more question before we break.
Hi, Avril. It's back at the ranch, Anne.
Oh, there's Anne.
Can I just say a word about that? It's the nature of rare diseases that we as patients or carers become experts. And it's our lived experience and our expertise that can add so much to this. We're very lucky. GPs are our gatekeepers. They really are, and the guidelines are so important. We're very lucky in 22Q that we have international guidelines, and before we secured our clinic, that's what kept us going, because the GP would have those guidelines and would work off them. So it's really important that our expertise, and like most of us, I think any rare disease patient has gone outside of Ireland to find their tribe, as I call them. And there's such a wealth of knowledge, insight, and experience that we can bring this forward. So I just wanted to say that. And thank you, everyone.
Thank you.
Thank you. We have one more question down the back, and then we'll go for...
Barra O'Brien from PSPA Ireland. I just would like to ask the panel. is it possible for consultants and people who diagnose, for them to give information or get their people that are working with them to get information to the patient at the time of being diagnosed? We have found in PSP that it takes approximately a year and a half to get a diagnosis, for example. But at the end of that, you have to go looking yourself all the time. Whereas these people are experts in the disease. But I would love to see doctors giving out, say, I'm just taking for us, we have a backup and an experience in PSP. So therefore, we could help that patient straight away. And I think the more medical people think that way and give us a bit of information to the patient at the time of diagnosis, because their head is up in the air. They're just, they don't know where they are. Thank you.
Yeah.
I don't know if Derek wants to comment.
I can probably comment on the first question, just in terms of the way that certainly I see the Rare Disease Patient Forum being influential and impactful is where patient groups, individual advocates can have their voices heard, but that collectivization can actually happen so that the priority can be clearly articulated to where the need is the greatest for rare diseases. The examples you've identified are perfect examples of that. It's then up to the system then to devise the channels and the ways that this can actually be implemented. So the point about how GPs can access care pathways, guidelines, not just relying on the individual in front of them, but they have an information system that they not only see as part of that consultation, but that they can easily use and the patient can actually feed in as well. So, and that's a very different relationship than maybe what currently exists, which is paper-based. There's very much reliant on the burden. It relies very much on the individual. So that's where I hope that can come out of the forum, because when we look at other areas of where this is actually achievable, the Cancer Control Programme has really tried to do this in a cancer-specific way in terms of survivorship and how that feeds into the national agenda. I would like this to do the same for rare diseases. So that's very much why we need that.
Yes, and just looking here, when I'm looking at you, Derek, I'm seeing over your head driving change through rare disease policy. And I think one of the things that's happening right now with while they're fledgling, and I think it's really important to say that European reference networks, should be better understood by GPs, and specific healthcare practices, because they will become the centres, much better known. They're, what they're doing, what they're for, how to refer patients to them, and in so doing, you're getting access not only at a national level to that expertise, but if your condition is not known within the country, I've got Vicky. It's, we have to, there is opportunity to get broader expertise across Europe. So there are opportunities, but they need to be developed. So there's some infrastructures in place that can support this, but it's early days. And so these are discussions that are really important as we move forward. So Vicky, I think that's you doing a dance down at the end.
Sorry, can I comment, please, Eileen?
It's Eileen.
Tracy.
Okay, sorry.
That's Vicky.
That's Vicky, but it's Eileen Tracy over here. Okay, sorry, go ahead.
Sorry, I'm not sure the microphone is working, but
yes.
just for on a positive note is that the care pathway and entry to the care pathway from the point of care, which we know for ourselves from review in Ireland is at primary care, is GP level. This is a very central point in the Jardine joint action. Yeah. And so this is signposting from the GP of where the care is in your country and where the care is throughout Europe, and is also delivering a clinical practice guideline into a simplified care pathway. And I just want everybody to know that this is a 3-year plan. It's not going to happen tomorrow, but Ireland has got a central role in this particular work package, and this is exactly what we are working to, with very, very strong cooperation with URDAs. So URDAs have a very central role in this pathway, and with EPAGs and all patients. So watch the space. The Jardine kick-off meeting is on next week. Thank you.
Yeah.
Thank you.
Thank you. Thanks, and thank you so much. Thank you to the panel, to Cecily, to Ryan, to Gillian, and to Derek for your insight this morning. And I'm sure we'll have further discussions